So my name is Guillermo Rocha. I'm a corneal specialist and ophthalmologist. I'm the academic chair of the Department of Ophthalmology and Visual Sciences, and also the chief of the Division of Ophthalmology at the MUHC here in Montreal, Canada. Mainly here in Montreal, we deal clinically with the MUHC, the Jewish General Hospital, as well as the St. Mary's Hospital. In terms of research, we have different areas. For example, the McGill Vision Research Group, which is located at the Montreal General Hospital. We have at the Research Institute of the MUHC a strong program in ocular pathology, both for clinical aspects and research. And in addition, at the Montreal Children's Hospital, we have the Gene Therapy Center, which is being developed and has been producing some very interesting work. We also have members of our department who are located at the Lady Davis Center in the Jewish General Hospital area. And so the areas that we currently have research activities on relate to vision health, vision technology, as well as immunology or basic cellular aspects of research in terms of ocular environments.
Could you highlight some of the most exciting research themes and innovations being pursued?
So in terms of some of the most exciting research themes and innovations that we're currently pursuing, I think one of the things that attracted me to move here to Montreal and accept this new role as chair of ophthalmology was the ability to collaborate with different disciplines. And in particular, I was really excited about the surgical and interventional sciences program as well. That was one of the big things. The second thing that really interested me was the aspect of simulation. So we have the Steinberg Center for Simulation, as well as the MUHC Center for Simulation. In addition, we have other simulation areas at Shriners Hospital as well. So combining those two, I would say the most exciting thing for us here in the Department of Ophthalmology and UHC simulation laboratory. So there's surgical teaching, but one of the most exciting things has been the implementation of a formal research program. And it's evolving slowly, but it encompasses aspects of ocular performance enhancement. In other words, we want to teach not only the actual surgical technical skills, but we also want to teach the non-technical skills, things that happen in terms of communication with patients, in terms of management of complications, and we have an active program on that. In addition, through our partnership with the SIS, we have an on-site postdoc fellow who is actively working on devices, and we're exploring opportunities in robotics as well. So all of that to say that within the past 3 to 4 months, really, this is an area that is expanding tremendously. It's innovative, it involves partnership, and it is also cutting edge when it comes to the unique offerings of a department like ours.
Looking back, what do you consider the most impactful innovations or breakthroughs that have come out of your department at McGill? How have they influenced patient care or research in ophthalmology?
Okay, so in terms of the most important innovations and research impact that we have had in our department, I would classify them into 3 different areas. The first one is visual technologies, the second is visual neuroscience, and the third one is vision health. So in terms of visual neuroscience, that has been an aspect of McGill research, which started around 1990, 1991. And it has done a lot of work in amblyopia treatment and amblyopia management. So that is an area that is still going strong and still producing a lot of research and a lot of publications, obtaining different grants. So that's one specific area. I would say in terms of vision health, the 2 areas that have had the most impact have been the ocular pathology laboratory and the research program there. And the second one is the genetics program. So in terms of ocular pathology, the ability to become or have become a leader worldwide in terms of ocular research, in terms of pathology, immunohistochemistry, as well as ocular melanoma, have been a very important contribution. When it comes to genetics, there are some genetic diseases such as Leber's congenital amaurosis. Through the research that has been done at McGill and in collaboration with our other institutions such as the University of Montreal, we've been able to offer and change the devastating nature of these diseases with some very, very interesting results, combining the use of genetic technology, surgical intervention, and then obviously the collaboration with pediatric ophthalmologists. The final aspect, I would say, is in terms of visual technologies. And that's where I think all of the aspect of our simulation lab comes into play. The opportunities there remain in terms of the non-technical aspects, device development, education as well, assessment of education and research in education, and also collaboration with industry in terms of offering courses and studying different aspects of new devices that they may be able to produce.
For students in the Surgical Innovation Program, how can they engage in research or clinical projects in your department? Are there specific areas where their skills in engineering, AI, or medical technology could make an impact?
So in terms of students from the Surgical Innovation Program becoming involved with our department, there are several aspects. For example, in AI, we're looking at different ways to triage consultations in order to make more efficient the flow of patients through our clinic. In terms of medical technology, we are working as well on devices that will allow us to document. So these are adapters for slit lamp or some of our microscopes that will allow us to document cases and follow them. In terms of skills in engineering, there are some of our residents who have been involved with the development of devices, for example, for glaucoma, and they have participated in some of the competitions. I think the biggest thing is communication. The biggest thing, I believe, is knowing what everybody else is doing. So I think by having potentially a bit of a think tank or an innovation presentation would be a good starting point. Many of us and many of our residents, if not most of them, will attend the McGill Ophthalmology Research Day. For example, this is on April 11 this particular year, 2025. But we have this every year, and this is an opportunity for researchers and clinicians to come together and present ideas. Just last year, I was able to introduce two different people, one a clinician and one a researcher, and now they're collaborating on a project, for example. The second aspect would be to talk to some of our residents and interact or come and spend a little bit of time here in the clinic, just sort of discussing some of the ideas. And I think the way we could do that is by organizing a short meeting with the residents just to present a pitch of some of the ideas that are being done by the Surgical Innovation Program students. So I think those are two ways. A third way would be to specifically contact some of the mentors or supervisors that are actively involved in research. And an email to our department would sort of be able to connect some of these individuals.
How do you see the future of ophthalmology evolving, particularly with the integration of technology and interdisciplinary collaboration? What role do you think departments like Surgical Innovation can play in shaping this future?
Well, this is a great question, and I'm very happy that it is being asked because right from the start, I moved here about a year and a half ago, and kind of like my mantra has been partnership and innovation. So this question combines those two. There's no way anybody in this day and age can do anything by themselves. Industry develops different equipment. Bioengineers develop certain ideas as well. And ultimately, what we all hope as clinicians is to benefit our patients. So being able to transcend some of those ideas and make them functional, I think it's very, very important. So how do I see the future? It's going to be more and more integrated. We have defined as part of our strategic activity the aspect of partnership and collaboration in our mandate for our Department of Ophthalmology. So we're already starting to cross-appoint individuals so that we have the perception of, for example, an individual who's an ophthalmologist, but is also part of the pathology department, somebody who's in genetics, also part of the ophthalmology department. Myself, I am also part of the Surgical and Interventional Sciences program in the Department of Surgery. So I think being aware of what's happening in other areas is very, very important. In our department, we are going through a reorganization or restructuring process as well. And the hope is that that will allow individuals, clinicians, for example, to see what different programs are available. And also the basic scientists running those programs will see which clinicians are interested in developing different aspects. Many of us as clinicians, we're busy with the day-to-day care of our patients, surgery, managing our patients, and making sure that they have a good surgical or medical result. So it's hard, even if we come up with ideas, it's very hard for us to develop them. So I think having that regular interaction, whether it's formal or even informal, will be a great way to continue collaborating. The next aspect, I think, is how do you crystallize an idea? How do you make it real? And what I've seen from the Surgical Interventional Sciences program and the CLIP program at McGill is that they do have the ability to assist with the development of patents and with the actual production of different prototypes. And so I think that's invaluable for people in clinics. So I think, what do I think there is? Well, in order for us to succeed, in order for us to evolve and innovate, we're going to have to work together, and we're going to have to bring our ideas together. I love the concept of the Medici effect. The Medici effect refers to the era of the Renaissance, where the Medici as sponsors brought together people of different disciplines, and the end result was the Renaissance. As opposed to having architects and engineers just working in silos, they all merged in Florence and produced one of the most beautiful times in the history of our humanity. And so I think the departments like Surgical Innovation Program and Surgical Innovation Interventional Sciences Program really have the ability of producing some of that Medici effect and bringing people together to exchange ideas. And that's when we really see the spark of innovation occur.
What advice or message do you have for prospective students considering research opportunities within your department?
So the advice I would have for prospective students considering research opportunities here in our department is to first have a couple of ideas. You know, often what we see is students saying, do you have any research opportunities? And it's hard for us to kind of define what those ideas are. We do have ideas, but sometimes it's hard to kind of make them more concrete. So I would say that if a student is very interested, they could start by saying, well, my idea, let's say, pertains to AI, okay? And so what aspect of AI would be to interpretation of images? Would it be to patient flow? Would it be to administrative aspects, patient care? You know, kind of define, narrow it down. Then from there, go through the roster of potential clinicians that are working in the department, and we're all sort of on the website, and we're upgrading our website as well. And then send a general email through our contact information page, and then we can kind of link the prospective student with a clinician who may be interested in a specific area of research. But I think coming up with an idea of a general concept. What is the technology used? Is it robotics? Is it AI? Is it surgical device? That type of thing. And then combining that with a more specific area of our patient care would kind of make it more attractive for us to kind of find the opportunity to work together.